it's a situation where you're already diagnosed with hypertension, it all depends on the stage of hypertension, because of course there are different stages. There's some persons who may have a mild form of the disease and some more severe. So in terms of managing, we look at these factors again. The diet. You have to have a balanced diet and control your intakes. You look at your exercise. We look at managing rest, the balance between rest and stress. So it's something I like to explain to my patients. If as soon as you get up, your body is already under some sort of stress, but then when you're confronted with other stressful events, it makes it even worse. So we have to manage the stress. We can't avoid stress completely, but we have to be able to manage it. And then if you're not resting well, meaning getting adequate sleep, because sometimes you might just be lying down, but you're really not sleeping. So the body is really not resting. So you want to manage that, that period of rest with that period of being under stress. The other thing that we need to look at is, once you're hypertensive, most likely you may be started on what we call oral medication or tablets. And it is advisable to take those medication according to how it's prescribed. So very important. Some persons like to say, okay, I checked my pressure today and it's fine, so I'm not going to take the medication. But when you look at it, these medications, they are designed to cover for a period of time. And so when you decide not to take the medication because you just don't feel like, then you're putting yourself at risk for your hypertension to get worse. So it's very important that you discuss it with your healthcare provider before you stop the medication or decide to alter how you take the medication. And the other thing that we have to look at is in terms of your checkup. It's very important because you might be checking your blood pressure at home and you think that it's okay, but still you need to have that discussion with your healthcare provider, whether it's the nurse or the doctor, because it might be a situation where you might have to change the medication or have a lower dose of the medication. So it's always good to discuss the way forward in regular intervals with your healthcare providers.